Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Welcome to Ask the Doc. Today, we're taking a deep dive into one of the most commonly heard of metabolic conditions, diabetes. From recognizing the early signs, to learning how it's diagnosed, to what can be done to manage it, and what are the complications if it's not managed, including the day-to-day challenges, the latest experiments, all of it. Whether you're living with diabetes or you're caring for somebody living with diabetes, we're going to talk about it all, and this show is for you. I'm here to provide you that information and to support you through it, as well as to answer your questions here on Ask the Doc. Welcome to Ask the Doc, the show where we encourage you to send in your healthcare-related questions. My name is Dr. Kamaljit Kaur, and I'm a primary care physician here in South Florida, and I'm going to give you some advice on recognizing and managing diabetes. Today's first question comes to us from Haley, who just reached out through our website, allhealthtv.com. Haley's question is, "Hi, Dr. Kaur. My 10-year-old son, Shane, has lost a little weight lately, which is peculiar because he eats and drinks like there's no tomorrow. Don't most 10-year-olds? What are some of the early signs and symptoms of diabetes that people should watch for?" Haley, this is such an important question because no matter the age, it is very important to recognize certain symptoms that might be red flag signs of diabetes. Now, I assume since your son is 10 years old and was just diagnosed that you're referring to diabetes type 1. For many of you who don't know, diabetes is often characterized into type 1 and type 2. We'll talk a little bit more about it later. But there's a lot of children who are being diagnosed not just with type 1, but with type 2 diabetes as well. Now, it can present in a number of ways, including, but not limited to, having excessive thirst. So you're drinking water, but you're just not satiated. You still feel thirsty all the time. Or excessive hunger, where you're eating and eating, but you still don't feel satisfied and you're still hungry. You can also experience excessive urination, where you're not drinking that much liquids, but you find yourself using the restroom a lot. Now, this may surprise you, but a majority of people are actually asymptomatic, meaning they are not showing any symptoms when they're diagnosed with diabetes. But this is why screening is so important. Getting screened every year with your physician at a primary care clinic, your annual exam, so important. Now, by the time you have the disease and you're having symptoms, it pretty much means that it's progressed to a certain point. So the sooner you catch it, the earlier you can treat it, and the better your chances of managing it without complications. But nevertheless, it's important to be very familiar with the symptoms of diabetes. It's so important that I'm going to put together a little list for you. So let's go through it. Number 1, frequent urination, as mentioned. Number 2, that excessive thirst I was talking about. Number 3, the extreme hunger I was referring to. And then there's unexplained weight loss, the fourth and probably one of the most common symptoms that we see first. Number 5 is fatigue. Number 6 is blurred vision. Number 7 is slow healing of your sores, because diabetes does reduce your immune system and the defenses that your immune system has. Number 8 is frequent urination and infections. Infections. And that goes back to the reduced immunity that you experience as a diabetic. So let's get to the next question. And this one is from Vance, who reaches out to us from YouTube. Vance asks, "Hey, Dr. K, so my wife took our little girl Abby to the doctor and she was just diagnosed with diabetes. What is it exactly? And can you give me a quick download on blood sugar levels?" Vance, I'm so sorry to hear that your little girl was diagnosed with diabetes. It's such a life-altering diagnosis, and it can have a lot of impact on our younger patients. I'm glad that you guys are there as her parents to help support and guide her through this. There's good news. The diagnosis may not be great, but with healthy eating habits, exercise, proper medications, I'm sure that she's going to live a long and happy life. Now, we hear a lot about diabetes, whether it's from doctors or the television ads for the diabetes medications. It's everywhere. But what exactly is diabetes? Now, essentially, diabetes is a disease state in which very high levels of sugar or glucose in your bloodstream cause a series of abnormalities in the way your body metabolizes carbohydrates, fats, and proteins. In simple terms, your body is not able to adequately deal with or metabolize these high sugar numbers in your bloodstream. And because of that, um, well, not because of that, but that is caused generally by your body's reduced ability to work with insulin. Now, insulin is really, really important because insulin is what metabolizes that glucose and that sugar. When high levels of sugar are allowed to run freely in the bloodstream, they lead to damaging effects in so many parts of the body, and this can result in health complications. Sometimes it can even be fatal. But I know that's extreme. Nowadays, your physicians, don't worry, we have a good handle on how to recognize and how to manage diabetes so it doesn't progress and get that far. Now, whether this is medications or just with lifestyle changes, it's all very possible to do nowadays. We have another question from allhealthtv.com. This is great. And this one comes from Lupita. Lupita asks, Hola, doctor. Can you tell me what the potential complications are if you don't take steps to manage your diabetes? I want to know because my husband was diagnosed with type 2 a few months ago, and he's not doing the things he needs to do. He needs to be scared straight. Hi, Lupita. Now, your husband's not being fair to himself or to you because when you're diagnosed with something as important and as drastic as diabetes, you need to take it seriously because even though it can be easy to manage, if it's not, then it can lead to very bad health complications. I don't generally like to use tactics to get my patients on the right track, but it is important to know that diabetes can result in these drastic complications. And, it's very life altering, if not life threatening. Now, there's many ways to do and to prevent these. But I think educating people about the dangers and the complications is probably one of the best ways to motivate somebody to treat their diabetes. As I mentioned earlier, having high levels of blood sugar or glucose can damage so many different parts of your body. And here are some of the complications. We can have nerve damage because those excess glucose levels do affect the nerves, and then that causes inflammation around the nerve, so you get nerve damage. You can also have cardiovascular disease. There's many ways that this can happen, but the fact of the matter is cardiovascular disease, heart attack, strokes, those are all possibilities. Third, we can get kidney damage. So whether that's kidney dysfunction or kidney failure outright, either one of those can happen if you don't take care of your diabetes. You can also get, number 5, eye damage. Blindness is one of the biggest complications that we see with untreated diabetes. Number 5, we can get foot damage leading to infections and amputations. And this happens because a lot of times the nerves that are in your feet are damaged by the diabetes. So when you're stepping on things that can harm you, like you step on a nail or if you step on glass, sometimes you don't feel that because your nerves aren't working to give you those pain receptors. That can lead to having a wound in your foot that you don't even know that's there. And so you don't take care of it. So it gets infected. And unfortunately, that can even lead to amputations. Amputations can also be a result of decreased blood flow in the lower extremities due to diabetes. Number 6, various skin conditions can result from uncontrolled diabetes and high levels of sugar. A lot of people develop one very visible patch of darker skin around their neck, and that is a sign often of undiagnosed and untreated diabetes. You can also have hearing impairment. And number 8, believe it or not, Alzheimer's disease. Those high sugar levels affect more than just nerves, your eyes, and your kidneys. They can also affect your brain health and your memory and concentration. Okay, so now we're firing on all cylinders because we're getting tons of questions, and I'm just trying to go through them and make sure that I pick out the ones that can give you the most amount of information. Our next one comes from Jewel. And Jewel's question is, Dr. Kaur, my sister-in-law, Jeanette, just found out that she has diabetes. I'm not sure if she has type 1 or type 2, so I'm curious what are the differences between the two? Jewel, that's a really good question because as I mentioned earlier, often we term diabetes as a disease that's just one thing, but no, there are 2 different types. I'm sure your sister-in-law is going to need help right out of the gate with this diagnosis. So it's great that you're educating yourself so you can support her through this. Now, I don't want to get too bogged down in a medical school lecture or in a school lecture here, but I think it's important to start from the beginning. Now, We'll start with talking about insulin, which is secreted by your beta cells. Your beta cells are made by your pancreas. And basically, these are specialized cells in the pancreas that release insulin. And insulin then goes and it promotes basically getting the sugar out of your blood and putting it to good use in your liver, in your muscles, and in your fatty tissue. Now, when it gets to those centers of the body, then it does all the good stuff it needs to do to really keep you healthy and keep your machine running. It helps to metabolize the glucose, then goes and helps to metabolize the carbohydrates, the fats and the proteins. I get so passionate about it that my brain goes faster than my mouth sometimes. Now, once this happens, like I said, your body is able to use the carbohydrates, the fats, and the proteins to keep your energy levels good, to keep your immune system high, everything working just properly. In diabetes, this pathway, for one reason or another, is limited or inhibited or gone altogether. There's two ways that this can happen, two general ways, and then that's where we go into type 1 diabetes and type 2 diabetes. Now, in type 1 diabetes, it's basically caused by an autoimmune destruction of those beta cells in your pancreas. Generally, this is something that you're born with, and because it's autoimmune, it basically means your body is attacking itself for one reason or another. And when that happens, the beta cells are essentially not able to release that insulin, and then your body can't metabolize the sugar that's roaming around in your bloodstream. So it's just going all willy-nilly and doing not so good things in your body. Type 2 diabetes is a gradual reduction in your body's ability to release that insulin. That happens for so many reasons. It's multifactorial. It could be a genetic cause. It could be because there's obesity, because the eating habits aren't right. There's no exercise. There's so many reasons for it. It's multifactorial, but the point of the matter is your body is not able to release the insulin and deal with those high levels of glucose. And really, no matter how it happens, type 1 or type 2, the point is that there's too much sugar roaming around in your body. And like I said earlier, that's going to lead to so many different kinds of complications that hopefully we want to avoid. All right, friends, we finally get a question from YouTube, and this one comes to us from Lucas. And Lucas asks, Dr. Kaur, my mom was just diagnosed with type 2 diabetes. I want to know if diabetes can be prevented or cured. And if so, what can I do to help her? Oh, Lucas, that is so sweet of you to be looking out for your mom and being there to support her. I'm sure she appreciates it very, very much. Now, I'm all about prevention. If you guys have watched our previous episodes, you know I really, really like to hone in on preventative methods. And one of the best ways to prevent type 2 diabetes is by living a healthy lifestyle. So what does that mean? Well, that means eating a healthy diet, one that's based mostly on whole foods and plant-based foods. So basically, if Mother Earth didn't make it, try not to eat it. Once in a while is okay. Exercising is very important, at least 30 minutes a day, at least 5 days a week. You want to get a moderate level of activity going so your heart's pumping and you're getting those good endorphins released. Very important. Getting at least 7 to 9 hours of restful sleep on average nightly is recommended. Managing your stress levels is so important. I know we've talked about that a lot before. Engaging in joyful activities with your loved ones, believe it or not, is also part of a healthy lifestyle. And all this is to say weight management. That's one of the most important things that you can do to prevent diabetes, is to reduce the amount of weight that you have, especially the belly fat. It's probably one of the most dangerous forms of fat that a human body can experience. Now, once diabetes is diagnosed, there's many different ways to treat it. According to the American Diabetes Association, medication should be started in a diabetic individual when their hemoglobin A1C is 7.5% or higher. Now, the hemoglobin A1C, as many of you may know, is the protein used to diagnose and monitor diabetes. When that number is 6.5 or higher, that is diagnosed formally as diabetes. So between 6.5 and 7.5, you have a chance of using just lifestyle measures as your main treatment mode. And that is what we prefer, to be very honest with you. But when that number starts to get higher and higher, above 7.5, that's when medications come into play here. Now, there's so many medications that are out now, but metformin remains, for most people, the first line treatment. There's a lot of reasons for this. It's been thoroughly studied, and the safety profile is quite good as well. So that's probably going to be the most commonly recommended one. Also, that does depend on your personal risk factors, your side effects, and your allergies. So you really want to talk to your physician and see which one is best for you. Now, as most of you know, of all the medications that are out there, the most famous one right now is probably semaglutide, which is branded as Ozempic. It's got a lot of different brand names now, and it's being prescribed really left, right, and center. It was originally created for diabetics because it works in different pathways in your body to enhance that insulin production. There's been a lot of other good effects that scientists have noted about this medication, so it's being prescribed for other indications as well, but primarily it remains a diabetes medication. Now, like I said earlier, it really depends on your personal risk factors, on which medication and what mode of treatment is going to be best for you. So please do talk to your physician about it. And no matter if it's medications or lifestyle measures, the basis of diabetes management is acknowledging that you have the disease, educating yourself about it, and really trying to stay as healthy as possible. Now, as far as curing diabetes, there's still ongoing debate in the medical community whether or not this is possible. A lot of major medical societies have their doubts that even though you can reverse diabetes and bring your A1C down to under 6%, even under 5.7%, which is the cutoff for pre-diabetes, that there's really no cure for diabetes. The body is still prone to it. Now, like I said, the debate is out there, the jury's still out, so we're not really sure. The studies are ongoing, and I'm sure as soon as there's a final verdict, it'll be announced. But for now, managing it to the lowest A1C that is healthy for you is going to be the goal. Now, whether that means it's short-term or long-term, point is just manage it as best as you can and be aware of those symptoms and those complications because you want to keep a handle on those. Now, we have a really interesting question here from Facebook, and this comes from Faith. Faith asks, I gave birth a few weeks ago. Congratulations, Faith. And my roommate was another pregnant woman who said that she had gestational diabetes. My question is, what is it, and what risks does it pose to both mother and baby? Hi, Faith. Congratulations. I hope you and your baby are doing just great. This is such an exciting time. Now, I hope that you had an easy pregnancy, and I hope you didn't have to experience gestational diabetes because it is a serious health condition. Now, gestational diabetes, is a term that we use to describe diabetes when it is diagnosed in a pregnant woman. It in itself is not different than regular diabetes. So we use that term just to make sure that we know that this was diagnosed while the woman was pregnant. Now, there is some debate. For instance, the American Diabetic Association suggests and notes that this term, gestational diabetes, should be given when a woman is diagnosed in her second or third trimester, because their research and their theories say that if it's diagnosed in the first trimester, it's likely to be undiagnosed diabetes from before. So that being said, we leave this to the second and third trimester condition of diabetes. Now, also, diabetes has a lot of health complications, as we discussed, for the mother for sure, but for the child, the unborn fetus, and after the baby is born, it can have complications then as well. And really recognizing this, the first thing to do is get those prenatal exams. As soon as you find out you're pregnant, get in touch with the OB physician and then schedule to have those regular prenatal visits because that's when the screening for diabetes is done, especially if you have a family history or if you've had gestational diabetes in a pregnancy before. So you really, really want to keep an eye on it. Now, some of the risk factors that diabetes has for the unborn fetus can be macrosomia, which is basically a baby who's born larger than average weight. That can be dangerous because it can sustain birth injuries during the birthing process for both the mom and the baby. Having abnormal glucose levels in the unborn fetus can lead to a lot of complications, as we discussed before. The baby can have metabolic complications as well. And honestly, the baby can even be stillborn. It can be a fatal condition. So you really, really want to keep an eye on it. And like I said, screening is of the utmost importance. So we have another question here from Instagram, and this comes from Jackson. Jackson asks, hey, Dr. Kaur, what are some diabetes education and support resources that are available for patients and their families? I'm a high school student, and my girlfriend was just recently told that she has diabetes. I want to help her as much as I can. Oh, Jackson, what? I don't want to embarrass you, but oh my goodness, that is the cutest thing. I'm so glad that you're there for her because as I've mentioned, having that support is so, so important. And I'm sure that she's very, very glad to have your support. Now, luckily, we have an abundance of resources out there to learn about diabetes. I mean, with the advent of the internet and social media and online resources, there's so much out there. So here's a list of those resources. I do want to say, though, before I get into the list, that you want to make sure you're getting your information from a credible resource, American Diabetes Association, the CDC, et cetera, et cetera. So number one, we have the diabetes education programs and classes. Now, these are nowadays abundant. To be honest with you, when I first started training and I was in medical school, there wasn't a lot of these, but now we're seeing them in more frequency. They can be provided by your doctor's office. They can be provided to you by even your insurance. A lot of insurance companies are covering these services for their diabetic patients. And it's so important to have all these resources, right? Then there's the certified diabetes educators. Yeah, these are individuals who have done extra training to be able to give you that education. There are online resources, as I mentioned, the American Diabetes Association. There's support groups and community organizations, because that's also very important to be in a group where there's other people who are dealing with the same thing that you are. It just makes it easier to go through. And then obviously your healthcare providers and a registered dietitian, they're all really, really good resources. So that was a lot of information today. And I know you probably have so many more questions on what diabetes is, how to diagnose it, how to manage it, and if it can be cured or not. The point of the matter is you want to get your regular screenings done, not just for diabetes, for a lot of preventable health conditions. And when it comes to diabetes, you can prevent it by living a healthy lifestyle, exercising, diet, sleep, reducing your stress. There are so many ways to do it. And honestly, having that good connection with your primary care physician in order to do it is so, so important. I hope that I was able to answer your questions. It's a very important topic, and I do encourage you to talk to your healthcare providers about it and your family members. Support them if they do have diabetes. That's all the time we have for today, folks. Like I said, I hope that you guys found this helpful and useful. It's been a pleasure. My name is Dr. Kamaljit Kaur, and I wish you all well.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.